Welcome to the Deep Dive, the show where we cut through the noise and get straight to the fascinating core of complex topics.
Glad to be here.
Today, we're uncovering something pretty surprising, actually. One of the biggest, most painful and, economically damaging issues for cattle worldwide, especially dairy cows.
Well, it's
Yeah.
often hidden right under their feet.
That's exactly right. We're diving into digital dermatitis. You might have heard it called things like hairy heel warts or maybe strawberry foot rot.
Vivid names.
They are, yeah. And it's this really nasty, highly contagious bacterial infection of the hooves. It's become a massive global problem.
So our mission today for this deep dive is to really unpack what digital dermatitis actually is. Why is it so, persistent? How does it spread sometimes in ways you wouldn't expect? What's the economic hit? And importantly, how are people actually trying to tackle it? We want you to come away with a really clear understanding of this often overlooked challenge.
Sounds like a plan. Let's get into it. Okay, we've mentioned the pain, but let's dig in. What exactly is digital dermatitis? What's it doing to these animals?
Right. So at its simplest, it's an infectious skin condition.
Huh?
It mainly hits the feet, usually the hind feet, and it's a huge cause of lameness in cattle.
Okay.
It first popped up, was identified in Italy back in the mid-70s, but since then it's just spread everywhere globally.
Wow.
And the bacteria involved, it's not straightforward. The main players are these spirochetes, Treponema species, but it's rarely just them. We actually call it a polymicrobial disease complex, fancy term, but it just means other bacteria like Fusobacterium necrophorum, Digilabobacter nodosus.
Yeah.
They get involved too. They kind of team up.
So it's like a gang of bacteria attacking the hoof.
You could sort of think of it like that, yeah.
Yeah.
And that bacterial teamwork is a big reason it's so difficult to treat effectively.
So if you were, say, looking at a cow's foot, what would you actually see? What do these lesions look like?
Well, in the early stages, the classic description is strawberry-like. Think small, red, quite moist, ulcerated patches.
Doesn't sound pleasant.
No, and they're incredibly painful. You often find them right at the back of the foot, near the heel bulbs, or in the gap between the claws.
Okay.
Then as it becomes more chronic, you can get these thickened, sort of proliferative growths, almost wart-like, and they often get covered with hair, hence the name hairy heel wart.
Right. I see the connection now.
Yeah. And to help vets and farmers talk about it consistently, there's a scoring system, the M-stage system. It goes from M0, that's healthy skin, all the way up through different active stages like M1, M2 for the ulcers, and M4 for those chronic hairy warts. There's even an M4.1 for when an old lesion flares up again.
So it's dynamic, it changes over time, and it can come back.
Exactly. That recurrence is a huge part of the problem.
And the impact. It's not just a sore foot, is it? That lameness sounds like it would affect the whole animal.
Oh, absolutely. Lameness is a major animal welfare issue. It causes serious pain, obviously. Cows are reluctant to put weight on the foot. They don't move around as much. They don't eat as much.
That affects everything.
It does. Their whole behavior changes. And the scale of this, it's not minor. Herd prevalence, the percentage of herds affected can be anywhere from 15% up to, well, over 80% in some studies in different countries.
Over 80%, that's huge.
It is. And in the U.S., estimates suggest over 90% of dairy farms are dealing with it.
90%.
Yeah. And what's interesting, or worrying, depending on how you look at it, is that while it was historically seen mainly in dairy cows, it's now increasingly showing up in beef cattle, too. So it's definitely spreading its reach.
Wow. Okay, so it sounds like once this thing gets established in a herd, it's just incredibly tough to get rid of. What makes it so stubborn?
Yeah, that's the million-dollar question, isn't it? It really comes down to how it develops the pathogenesis.
Yeah.
We don't understand every single step perfectly, but we know these Treponema spirochetes, they need to invade skin that's already been damaged somehow.
Okay, so what's causing that initial damage?
The big one, the really critical factor, is moisture. Prolonged exposure to wet conditions or constant contact with slurry, manure. It softens the skin.
Right, like your hand's getting wrinkly in the bath, but much worse.
Exactly. It compromises the skin's natural barrier function, makes it weak, and that gives these opportunistic treponemes the opening they need to get in.
And you mentioned something earlier about them hiding. That sounds like a key part of the persistence problem.
It absolutely is. This is, I think, one of the most fascinating and frustrating aspects. These Treponema bacteria have this ability to change form deep inside the skin layers. They can become what's called an encysted form.
Encysted, like they build a little shell.
Sort of, yeah. Think of it like they're going dormant, hunkering down. They create these hidden reservoirs within the skin tissue itself.
Okay.
And that is a major reason why these lesions keep coming back, why it's so persistent. It explains why you can treat a cow with antibiotics. The lesion looks like it's healed up nicely on the surface.
But it hasn't really gone away.
Exactly. The bacteria are still there, deep down, just waiting for the conditions to be right, maybe some more skin damage, maybe stress on the cow, and then they reactivate, and boom, the lesion comes back.
So they're essentially playing hide and seek with antibiotics and the immune system. That really explains the chronic nature. What about the cow's own immune response? Does it not fight back?
Well, it tries, but it seems limited. Or maybe ineffective is a better word. Cows do produce antibodies against these bacteria, but the response doesn't seem to be enough to clear the infection properly. These Treponema species seem pretty good at evading the immune system. And that immune evasion is a huge hurdle for vaccine development. People have been working on vaccines for years, but getting one that's consistently effective has proven really, really difficult because of this.
Okay, so beyond the tricky bacteria themselves, what else is driving this? The environment must be huge. You mentioned moisture.
Oh, massively. Wet, muddy conditions are prime real estate for DD. Studies have literally shown that pens with, quote, more mud than bedding had like 8 times the odds of DD cases compared to dry pens.
8 times.
Yeah, and if it was excessive mud, the risk jumped even higher, maybe 14 times higher. So yeah, hygiene is critical. Poor pen cleaning, high stocking densities where cows are crowded, inadequate foot bath management. It all contributes.
And you mentioned a surprising way it spreads, something about humans accidentally spreading it.
Yes, iatrogenic transmission, basically spread caused by us, by people. Hoof trimming equipment is the classic example.
How so?
If hoof knives, brushes, whatever tools are used, aren't disinfected properly between cows, those bacteria can survive on a hoof knife for several hours.
Wow.
So you trim an infected cow, then move straight to the next one without disinfecting. You're potentially transferring the bacteria directly. Sharing equipment between farms without thorough cleaning is another big risk. Even not changing gloves between cows can do it. It's easily overlooked, but really significant.
That's something farmers really need to be aware of. What about the cows themselves? Are some just more likely to get it?
It looks like it, yeah. There definitely seems to be a genetic component. Some cow families or breeds might be more susceptible than others.
Interesting.
Plus, the cow's own condition matters. Her metabolic status, like a dairy cow right after calving when her system is under stress, or maybe cows that are overconditioned. Even hoof shape, things like low heels or legs that are shaped a certain way, what we call sickled hind legs, can increase the risk.
And how does it actually move around? You mentioned slurry.
Slurry is a big one for environmental spread. The bacteria can survive in it for, well, up to 24 hours, apparently.
A whole day.
Yeah. But the main source within a herd is usually infected animals that have active open lesions. They're shedding bacteria constantly. So animal-to-animal contact is key.
Right.
And for a clean herd, bringing in new animals is probably the biggest risk factor for introducing it in the first place.
Makes sense.
And here's another interesting one, grazing alongside sheep. It's a potential route because sheep get their own form of digital dermatitis called CODD, contagious ovine digital dermatitis. And it involves the same Treponema bacteria.
So it can potentially jump species.
It seems possible, yes.
Yeah.
Co-grazing is definitely flagged as a risk factor to consider.
Okay, so this all sounds pretty bad for the cows, obviously. But why should you, our listener, really care about what seems like a very specific hoof problem? Well, the answer often comes down to economics. Digital dermatitis carries a massive financial burden.
You're absolutely right. It's often way more costly than just the immediate treatment.
Yeah.
The direct costs are clear enough. You've got the expense of antibiotics, maybe bandages, other treatments.
Yeah.
Then there's milk that has to be discarded because of drug withdrawal times. The extra labor needed to spot lame cows, handle them, treat them.
Time is money on a farm.
Exactly. And vet visits or paying for professional hoof trimming services. It all adds up very quickly.
But you're saying the indirect costs are the real killer here. Things like lost milk?
That's where the biggest drain often is. DDD causes a significant drop in milk production. Studies have shown cows can lose, several kilograms of milk per day for maybe up to 3 weeks after they're diagnosed.
Per cow, per day. That's substantial.
It really is. And think about heifers, young cows just starting out. If they get DD even once before their first calving, it can cut their total milk yield for that entire first lactation by hundreds of kilograms. Multiple infections, even bigger losses.
Wow, so it affects their whole productive life right from the start.
Yeah, and it hits fertility too. It messes with reproductive performance, lower conception rates, taking longer to get pregnant again after calving. Those heifers with multiple DPD infections. One study showed their conception rate to the first AI dropped by over 13%, and it took them almost a month longer, 25 days, to conceive.
That impacts the whole herd replacement cycle.
Absolutely. And lameness in general, DD included, is a major reason cows get culled prematurely. They leave the herd earlier than they should, which shortens their productive lifespan and means farmers have higher replacement costs.
So when you put actual numbers on it,
Well,
what's the bottom line cost per case?
it varies, of course, depending on severity and treatment, but the average cost for any case of lameness, DD included, is often estimated somewhere between, say, $100 and $700, maybe around $440 on average.
Okay.
But digital dermatitis specifically tends to be more expensive. Estimates put it maybe between $170 and $210 per case, and one study found it was nearly $100 more per case than other causes of lameness.
So it's one of the pricier hoof problems.
It often is.
Mm-hmm.
And then scale that up. Given how widespread it is, the annual cost of just digital dermatitis in the United States alone, estimates are around $1.4 billion.
Billion. With a B.
Yeah. Assuming something like a 25% herd prevalence rate, it's a massive, often silent drain on the entire industry.
Okay, 1.4 billion. That definitely gets your attention. So now we understand the scale of the problem. Let's shift to solutions. How do you even diagnose this thing properly, especially those early sneaky lesions?
Yeah, finding it early is key, but tricky. The gold standard traditionally is actually picking up the foot, cleaning it, and having a good look. Usually done when cows are in a trimming chute.
Right, get a proper close-up view.
Exactly. That gives you the best chance to see the lesion clearly and classify it using that M-stage system we talked about.
Right.
It's a lot of work. It's labor-intensive, it costs money to run cows through a chute, and it can be stressful for the animals. Plus, you might still miss early lesions, especially if the cow isn't obviously limping yet.
So what are the alternatives? How do farmers spot it day to day?
More practical methods are used routinely, like inspecting feet while the cows are being milked in the parlor, using a bright light and maybe a mirror on a stick to get a view of the back of the heels. That actually works pretty well for catching those common hindfoot lesions.
Ah, clever.
Yeah. And technology is starting to play a role too. Things like infrared thermography, looking for heat spots associated with inflammation, are being explored as potentially faster, less invasive ways to screen cows.
Interesting. Okay, so say you found a lesion. What's the actual treatment plan? How do you tackle it?
It really needs a multi-pronged approach. Step one, absolutely crucial, is to properly clean the lesion. Get rid of any dirt, manure, dead tissue debridement, we call it.
Got it. Clean the wound.
Precisely. Then, the most common approach is topical antibiotics, usually something like oxytetracycline, often applied as a spray or a powder directly onto the lesion. Sometimes it's bandaged to keep the medication in contact longer. There are other options too, like solutions of copper sulfate or zinc sulfate applied topically. And in really stubborn, severe chronic cases, sometimes surgical removal of the lesion is considered.
What about antibiotics given as an injection, systemic ones?
They can be used, yeah. Parenteral oxytetracycline is an example.
Mm-hmm.
But often, they aren't enough on their own to really knock down the infection right there in the foot skin. Those topical treatments, applied directly, are usually considered more critical for DD.
Right. Target the source.
Exactly. And don't forget supportive care. Minimizing stress for the cow, making sure she can easily get to food and water, gentle handling. It all helps recovery.
We keep coming back to this. Even with treatment, you said it often comes back. Why the high recurrence rates? It sounds incredibly frustrating.
It is incredibly frustrating for producers. And it goes right back to that encysted bacteria we talked about, hiding deep in the skin.
The hide-and-seek champions.
Pretty much. They create that reservoir. So even if the topical treatment clears the active surface lesion, those dormant bacteria can reactivate later, causing a relapse. That's the core reason for the high recurrence.
And you mentioned antibiotic resistance earlier, too.
Yes, that's a growing concern globally, not just with DD, but it's relevant here because antibiotics are used so widely. We are finding evidence of antibiotic resistance genes within DD lesions, which could make standard treatments less effective over time.
So no silver bullet, then?
Unfortunately, no. There's no single treatment that works perfectly every time for every case. And another challenge is pain and compliance. Some treatments themselves, like certain foot bath chemicals, formalin is one example, can actually be quite painful for cows if they have those raw, acute strawberry-like lesions.
Ouch. So they might resist going through the foot bath.
Yeah, which affects welfare and means the treatment isn't as effective if they aren't getting proper contact. It's a complex picture.
Definitely sounds like it. So if there's no magic bullet cure, how do you build resilience? What's the overall strategy for actually preventing and controlling this persistent problem?
Right. This is where you really need a comprehensive integrated plan. Because it's so complex and keeps coming back, just doing one thing isn't enough. You need to hit it from multiple angles.
Okay.
We often think about it in terms of sort of three pillars. One, biosecurity, basically, how do you keep it out of your herd in the first place? Two, biocontainment, if it's already there, how do you stop it from spreading within the herd? And three, promoting healthy skin, how do you make the cows themselves more resilient?
Makes sense. Let's break that down. Biosecurity, keeping it out. What are the key steps there?
Well, the absolute best way, ideally, is to maintain a closed herd.
Yeah.
Don't bring any new animals in.
Easier said than done sometimes, I imagine.
It often is, yeah. So if you do have to bring in new animals, strict protocols are vital. Quarantine them first. Inspect all 4 feet of every single animal very carefully.
Right.
Treat any suspicious lesions before they mix with your main herd. And it's often recommended to run new animals through a treatment foot bath, maybe twice, just to be safe.
Good precautions. What else for biosecurity?
Remember the sheep connection. Avoid co-grazing cattle and sheep if possible because of that potential cross-species transmission risk.
Right.
And that equipment disinfection we talked about, it's crucial. Not just cleaning tools between farms, but disinfect them between individual cows. Some even recommend disinfecting between hooves on the same cow if you find a lesion.
Wow, that's meticulous.
It needs to be to really stop the spread. And having farm-specific boots and coveralls for any visitors, vets, hoof trimmers is another good biosecurity layer.
Okay, so that's keeping it out. What about biocontainment, stopping the spread if it's already in the herd?
Segregation is a big one here. If you identify cows with active, open lesions, those M1s and M2s, isolate them if you can. They're the main source shedding bacteria into the environment.
Keep the spreaders separate.
Exactly. And again, hygiene for people handling cows. Change gloves, or at least disinfect them thoroughly, between treating infected and non-infected animals.
Makes sense.
Then there's manure management, super important. Regular scraping of walkways, yards, collecting areas, anywhere cows walk or stand frequently. Deal with any areas where slurry pools. Keep bedding clean and dry. Remember, slurry doesn't just harbor the bacteria, it actively damages the skin barrier.
Right, double whammy.
Yeah. And then, reducing the overall reservoir of infection. That means prompt treatment of any clinical cases you find. Some farms have success with a blitz treatment, basically, treating all identified clinical cases at once to really knock down the infection level in the herd.
A coordinated attack.
Kinda, yeah. And in herds with really persistent problems, sometimes difficult decisions have to be made about culling animals that just keep getting chronic, recurring lesions and acting as sources of infection.
Tough choices. You mentioned early detection being important too. How are farms doing that systematically?
Several ways. Regular mobility scoring is common, having trained staff routinely watch cows walk and score their gait to pick up subtle signs of lameness before it becomes severe.
Catching it early.
Exactly. That parlor inspection technique with the mirror and light is a great routine check. Some farmers do it at the feed barrier too. And technology is helping here as well. Automatic lameness detection systems that use sensors, like pedometers on cow legs, to monitor activity and gait objectively 24/7. They can flag cows that might need checking.
Okay, and foot baths seem like a cornerstone. What makes a good foot bath protocol? Just walking them through some blue liquid isn't enough, I guess.
Definitely not. The design matters. Ideally, a foot bath should be long enough, at least 3 meters, maybe 10 feet, so each foot gets submerged multiple times. Ideally, 3 dunks per foot. That ensures good contact time.
3 dunks, got it.
Then the chemical. You need to use an approved disinfectant at the right concentration. Formalin, usually around 5%, or copper sulfate, maybe 5%, are common choices. But follow the label instructions carefully.
And how often?
That depends a bit on how bad the problem is in the herd. But a good evidence-based starting point might be something like a 5% copper sulfate bath at least 4 times a week.
Okay.
And one more really crucial thing, preparation. If cows' feet are caked in mud and manure when they walk into the foot bath.
The disinfectant can't get to the skin.
Exactly, just disinfects the dirt.
Uh-huh.
So ideally, you want cows to walk through a pre-wash bath first, or have some way to get the worst of the muck off before they hit the treatment bath. Clean feet are key for effectiveness.
Right, makes perfect sense. And the final pillar was promoting healthy skin-building resilience in the cows. What does that involve?
A lot of it comes back to that clean, dry environment we keep mentioning. It really is paramount. Good overall cow, comfortable stalls, minimizing time spent standing on wet concrete, having wide alleyways so they aren't overcrowded and stressed, effective manure removal, lots of dry bedding.
Happy cows, healthy feet.
To some extent, yes. Reducing overall stress is important for immune function. There's also ongoing research into genetic resistance. Can we selectively breed animals that are naturally less likely to develop DID?
That would be a game changer.
It would. And generally supporting the cow's immune system, managing other diseases effectively, avoiding overcrowding, good nutrition, it all helps build that overall resilience.
So, wrapping this all up, what's the big takeaway for you, the listener? It seems clear that digital dermatitis is way more than just a simple foot issue.
Absolutely. It's this really complex, multi-layered challenge. It impacts animal welfare deeply. It hits the economics of farming hard. And it's driven by this tricky interaction between bacteria, the cow's own susceptibility, and crucially, the environment she lives in.
And that persistent, recurrent nature, the hiding bacteria, it means there's just no easy, quick fix, is there?
No, definitely not.
Yeah.
It requires that long-term integrated approach we've been talking about.
Looking ahead then, what are the big frontiers? Where does research need to go?
Well, the hunt for an effective vaccine continues. That would be huge. But cracking that immune evasion problem is tough.
Right.
And there's a real push for developing more sustainable, targeted treatments, things that can effectively treat lesions but reduce our reliance on broad-spectrum antibiotics, especially given the global concerns about antimicrobial resistance. We need smarter, more targeted therapies.
That seems critical. Which brings us to a final thought to leave you with. We've talked about the huge, maybe somewhat hidden economic costs of digital dermatitis, over $1 billion annually in the U.S. alone. It makes you wonder, what other seemingly small or localized animal health issues might be out there quietly costing industries billions? And how much potential is there really if we truly prioritized a holistic, integrated approach, not just to treatment, but to overall animal well-being and prevention? Something to think about.